Over the past month, the Department of Social Services and Department of Health traveled the state to seek input for the best uses of grant money, potentially worth up to $200 billion yearly.
Well, this week the state submitted its application. In a health alert, Grant Green has the details on what the plan is as the state waits for that grant money to come in. Hello, Grant.
Good evening, Brian and Kara. This grant is for the Rural Health Transformation Program put in place to help offset the changes coming to Medicaid and Medicaid, and it will last over the next 5 years. After fielding input for weeks, the state is confident in its application for this money.
Just anticipating that money coming at the end of December, we know we want to be able to hit the ground running in January with some initial steps. So we will be doing some preliminary planning, not putting too much time and effort into it, but doing what we need to do so that when we know our funding allocation, we're able to start that work as soon as possible.
The state submitted its application with 4 key priorities in mind. One big goal for the state is to get health facilities as up to date in technology.
And an electronic health record is really so much more than just your patient health record. There really are a lot of tools within that help increase preventative care rates and really help providers collaborate on care more. And there's just a lot of tools in that space that can help providers improve metrics for folks.
The Center for Medicare and Medicaid Services listed food as a, quote, not allowable expense as part of the application. One advocate for food health says it should be thought of more in that way.
Being able to connect both food as medicine with the healthcare system, we know that when patients have access to healthy, nutritious meals, that there's less chronic illness, less visits to the ER and to clinics.
The governor's office will be informed of the amount of money allocated to them before the end of the calendar year.
And an interesting factoid, South Dakota, according to the data that the Center for Medicare and Medicaid Services is using to judge rurality, ranks 33rd. Higher populations in bigger states being the main consideration. Ringling says she doesn't believe the state will get the full $200 million yearly, but likely at least something close.